everyone, welcome to our YouTube channel. And today I am here with you people with a new topic. And today's topic is about OOS, OOE, and OOT. Now let's begin with the OOS. Okay, OOS stands for out of specification. Okay, OOS is the result that falls outside the established acceptance criteria which have been established by any official company or other any pharmaceutical industry or documentation, its documentation or any specification. Let's take an example like if the limit of the assay is within 95 to 105%, but the reported assay is about 92%, and then the result is said to be out of specification since it is not within the limit. Okay, then if we got the result outside the specification, then what should we do? Then basically at this situation we need to find out the root cause of that OOS, okay, of that out of specification result. What is the main cause of that result? Okay, that factor might differ from time to time, but it might be related to the manufacturing process, or it might be related to the errors that might happen during the sample testing, or due to the malfunctioning of the equipment. Okay, and at this stage that whenever an result is out of the range, and that means whenever there is OOS result, okay, out of specification result, then FDA has said that an investigation must be carried out. Okay, investigation should be carried out every time, and that investigation should be carried out in a fine proper way, and that result should be recorded. Every document should be recorded, and corrective and preventive action should be taken for that thing. Okay, as per FDA, that investigation is carried out in two phases. Okay, and phase 1 and phase 2. Okay, under phase 1 investigation, laboratory investigation, that we must firstly identify whether the methodology that we had used was applicable or not, either whether our instrument were calibrated or not. Okay, and then we can also find out whether the analyst that give the result was trainee or expert. Okay, another thing that must be considered, like what are the reasons, okay, what are the factors for OS result in laboratory, that while sample handling, the analyst might have not taken the preventive measures. Okay, or incorrect handling of the sample might also gives the OS result. Another thing is incorrect use of the reagent, or that sample might not have been incubated at the right temperature at the right time. Okay, and another things like that might be like not reporting in a correct unit of measurement, or another things like incorrect reading of the observation or the result. That might be the reason. Okay, and what are the responsibility of the analyst? Okay, at that situation, if any result is being out of specification, that result must be recorded, and that analyst must report to the to his or her supervisor. Okay, and if the supervisor finds out that result is out of specification, that then resampling or retesting can be carried out. Okay, and if we got that it's due to the, if OS result is due to the laboratory error, then we can take the corrective or preventive measures over that thing, or if not, then we have to go under the phase 2 investigation. Okay, that full scale OS investigation under the phase 2 observation, phase 2 investigation. And in this phase that we need to undergo the production review of the production process, manufacturing process, and packaging process, resampling, retesting. Okay, that things can be carried out, and after the completion of that thing, we can take the preventive and corrective and the preventive actions. And if after that thing we came to know that our results is within the specification, then we can take the very effective measures. And if these corrective and preventive actions are fruitful, then our batches will be accepted and that can be dispatched, okay, at right time. And similarly, after completion of this OOS topic, we can say about another topic like as OOE. Okay, and what does OOE stand for? Okay, OOE stand for out of expectation. Okay, out of expectation. For example, if we take a drug product, or if we take a sample and if we undergo its DJO, and then the result is within the specification, but some sample might give the result that it is beyond the expectation. Okay, for example, if the limit or the specification says that DJO must be less than not less than 75%, and if there are 5 samples result are within its specification and its sequence is almost similar, but if the 6th sample gives the result very differently, for example, like it's 158%, for example, if specification says not less than 75% and its result is 158%, and another 5 samples are within 80 to 90%, then that 6 sample result is said to be out of expectation. Okay, that means out of expectation is the result that is a very aberrant or anomalous result. Okay, so we can say that for this out of expectation result, what things can be done, we can find out that things, and then we can take the corrective and preventive measures. We can firstly focus on its factors, what are the causative factors for that out of expectation result, and then after that we can take the corrective measures. Similarly, another like OOT. Okay, OOT means out of trend. Okay, and basically in our normal testing, that OOT problem do not come. Okay, OOT mainly arises during the R&D phase, or when the drug is under its developmental stage or pre-formulation stage. Okay, OOT means out of trend. Okay, it does not matches with trend or the result when we compare the results with its previous batches or stability testing, then that is not within its trend. Okay, the result is out of trend, that is completely different from the previous result, that is called as the out of trend OOT. Okay, I think we have completed the today's topic, and if you people have any queries related to OOS, OOE or OOT, then please let me know, and please do like, comment, share and subscribe our YouTube channel. Thank you so much.